I'm Ken Fleming. I represent the 48th District, which is part of Oldham and Jefferson County. Today, we're here to introduce House Bill 200, a broad-based, very much of an unprecedented approach to addressing Kentucky's healthcare workforce shortage. In conversations with healthcare stakeholders, families, and throughout the media reports, studies, and interim committee meetings and EMS task force hearings, we at the General Assembly hear people loud and clear, and we're taking action. Kentucky has an ongoing healthcare workforce crisis, and its growing crisis, which threatens not only to burden families and providers, but also may jeopardize the very vulnerability, or availability, I should say, of critical health services to citizens throughout the Kentucky. Over and over again, we have heard education and opportunity are the keys to address this shortage, which is exactly what House Bill 200 does. Simply put, this bill kickstarts career paths for all Kentuckians interested in healthcare career, and it puts a jetpack on the healthcare training pipeline. House Bill 200 creates a public and private partnership that establishes the Healthcare Workforce Investment Fund that has two buckets and be administered by a CPE. First, at least 65% of the funds will be used to encourage healthcare partners to partner with educational programs to pledge funds matching dollar for dollar to establish scholarships to healthcare education. The other bucket, which is up to 35% of the funds, will be used to incentives for universities and training centers to invest in building up faculty and provide equipment and other assets. Metrics, measurements, outcome, which from a business perspective, I'm pretty much keen on that. We're going to have certain metrics in terms of graduation rates and pass rates of licensure examinations and other standards that will be used to reward excellence. Kentucky has a rich history in enacting successful public-private partnerships, which is a long-standing research challenge fund known as Bucks for Brains, and other statutory matching funds. In states like Florida, enacted similar legislation that uses the public and private partnership with nurses. But this bill, House Bill 200, goes a step further. Based on all the information we have come across over the past year and a half, we are broadening the base. We're going to include mental health professionals, paramedics, EMTs, nursing aides, physical therapists, dental hygienists, and many, many others. This bill also addresses the underserved geographical regions and underserved professional disciplines. And we've seen studies back in about 10 years ago, and hopefully we'll have another study coming out soon that looks at these different disciplines on where the gap is, so we can go through and allocate those folks that are coming through this system in terms of getting these scholarships and graduating to be put in those particular areas. We're also looking at helping out small businesses. And once again, being a business owner, 80% of the economy is driven by small businesses, and we have a provision to help out small businesses. And as I said before a few minutes ago, we're putting strong metrics and accountability to make sure the ROI of public and private funds are coming to fruition. Over the past months, Kentucky Hospital Association, Kentucky Nurses Association, K-Beams, Kentucky Center for Assisted Living, Kentucky Association for Healthcare Facilities, Kentucky Chamber, the Healthcare CEO Council, and many, many others have helped perfect this legislation. I want to thank each and one of them and the stakeholders for their valuable input. And in particular, I want to thank the CPE. The gentleman to my left, to your right, has been very instrumental in making sure that this comes to fruition, Dr. Thompson. Without his insight and his staff's insight has been very, very valuable, which we deeply appreciate. I just also want to recognize, before I turn it over to Dr. Thompson, I want to recognize some of my colleagues here that have been very instrumental in the process of this. Representative Hart, Representative Tipton, Senator Meredith, a representative and chairwoman, actually both got a couple of chairs here, sorry to overlook that, and Chairwoman Kim Mosier. So With that, I want to turn over to Dr. Thompson for him to add some of his comments and thoughts on it.
Thank you, Representative Fleming. Co-sponsors, as a matter of fact, you got a good group to co-sponsor with you. I appreciate the work on this. So much I can talk about, and I won't take up a lot of time. I just want to say this, that as we look at what Kentucky needs to have a viable economy, we're going to have a healthy economy. In order for Kentucky to get where Kentucky needs to go, we're going to have a lot more people in health care and all facets of health care providing that. So I really appreciate this bill. Now, first of all, this is important to Kentuckians to access quality health care, and access cannot be certain without enough providers to do so. I had a chance to talk with a couple of our higher ed institutions a minute ago. BCTC, as an example, has tripled their nursing process in some of the work we've done here. But this bill goes to the sustainability of that. It's important for the financial support to happen at the level that it is happening. The best public-private partnerships are those that work on the front end to actually build out a long, sustainable pipeline. General Assembly helped us last year with some seed funding to show that it will work. And I want, first of all, Dr. Leslie Sizemore, I have to thank her, who is the head of our healthcare collaborative, that's doing this kind of work. Healthcare employers, and as someone who has sat on the largest healthcare system in Kentucky for the last many years and been the chair for the last many years, I can tell you the need is so severe that without us having this sort of innovative partnership, this sort of innovative bill, I don't think we could even come close to getting where we need to go. You know, this bill speaks directly to the needs of employers, keeping hospitals and clinics open in ways that at times they've had to close because of shortage, or at least cut back on the essential needs that they needed to provide our citizens of Kentucky. This bill is obviously important to higher ed, and as the head of higher education for Kentucky, I will tell you that it's amazing when I'm hearing the response already. As we passed along the idea that this bill was in the works, they were applauding that this sort of innovation could take place where they would have a lot of their skin in the game to get where we need to go. We will look at the return on investment. We will look at quality. It's not just about quantity. It's making sure you want someone in the healthcare profession to provide you with what they need. You want to make sure that they know how to do it. So we won't do this purely in a quantitative way. It'll focus heavily on the qualitative outputs that we need. Kentucky's economy is truly the ultimate way that we think about this in higher education. We know that you have to have a highly educated workforce, and that workforce needs to be healthy. In order to have a highly educated workforce, you have to have a strong higher ed system. This bill goes to really increasing that system strength, if you will, with our private and public relationships. I am more than appreciative to the CEOs of these healthcare corporations, small and large, to be with us in this game, to be with us in this process. And Representative Fleming, I would be remiss if I didn't say what a joy it's been to work with you at the levels that we have, and your receptiveness of looking at how we can make this bill something that would be accomplishable and doable, and in fact get the results that you want. So I appreciate us being a part of this conversation with you. Thank you.
Good afternoon, everyone. My name is Josh Williams, the Vice President of Strategic Initiatives with the COC, the Healthcare CEO Council. Thank you so much for the opportunity to be here. And you know, for those that aren't aware, the COC is comprised of the 15 largest healthcare organizations that are founded or headquartered in Louisville, Kentucky. And our mission is very simple. So we want to leverage that collection of industry leadership really to solve these healthcare challenges that are bigger than any one organization. And doing so really enhance our regional economic vibrancy as a result of that. Well, I'll say for all 15 of our council member companies, the workforce crisis that we're experiencing today, which has been aggravated over the past 3 years, is something that we're all collectively unified in addressing together. And so this is very, very evident with the comprehensive work that we're doing around the Center for Healthcare Workforce Innovation, which is supported through a broad coalition of community organizations that are supporting this work. And that really what this looks like is that this is a huge opportunity with this bill to complement that strategy. and to bring it to the state level and to make sure that we're moving this as much as possible, because although there are multiple industries that are within a workforce crisis, this is very, very important to healthcare, who has been uniquely positioned next to the COVID pandemic over the past 3 years. So this serves as a strong complement to that work, and I just want to say a huge thanks to Representative Fleming for the leadership in bringing this forward. Our council member companies who spent working tirelessly in putting the language together and building this into what it is today, as well as the several associations and other organizations who played pivotal roles in getting this where it's at today. So a huge thank you for that, and we are excited and thrilled to support this bill and look forward to doing that moving forward. Thank you very much.
Hi, good afternoon. My name is Jennifer Wiseman, and I am here speaking today as a member of the Kentucky Nurses Association. The Kentucky Nurses Association is the professional association established in 1906 that currently represents all 90,000 nurses here in the Commonwealth. One issue that has been discussed extensively over the past year, even at a national level, is the nursing workforce shortage. While this remains an issue all over the country, we applaud the efforts made by legislators here in Kentucky, Representative Fleming, who are willing to work with nursing leaders, healthcare organizations in both the private and public sectors, and professional associations to come up with real solutions to enact change within our healthcare environment. Like I mentioned, we want to thank Representative Fleming for his tireless efforts and constant outreach to multiple entities, which has led to the creation of this Healthcare Workforce Investment Fund. The goal of this legislation is broad in that it intends to help many entry to workforce areas that are currently feeling the strain of shortages. With regards to nursing, this legislation will help decrease financial barriers that are currently preventing qualified individuals from entering the nursing workforce pipeline. This includes those individuals wanting to become certified nursing assistants, those wanting to become licensed practical nurses, and those wanting to become registered nurses, all of which are needed at this time. Not only will this fund allow the nursing profession to increase the number of applicants into the workforce pool, but this legislation also brings up another key issue related to the retention of nurses that we already have, including those who are currently working as faculty within our nursing programs. It is imperative as a profession that our pipeline of up-and-coming nurses is strong. To create a strong pipeline, our nursing programs must be adequately staffed with nursing faculty in order to produce the high quality and exceptionally trained nursing workforce that the people of Kentucky deserve. As one of the 90,000 licensed nurses in this state, and on behalf of the Kentucky Nurses Association, I want to again thank Representative Fleming on the creation of this fund. The KNA always appreciates the opportunity to collaborate with legislators and other healthcare organizations to make sure the Commonwealth's nursing workforce is second to none. This is precisely the type of legislation that we urge the General Assembly to pass because it benefits nurses here in Kentucky, and especially those wanting and aspiring to be part of the nursing profession.
Hello, my name is Betsy Johnson, and I'm speaking on behalf of the Kentucky Association of Healthcare Facilities and the Kentucky Center for Assisted Living. We represent over 270 of Kentucky's long-term care providers who have made the recruitment and retention of direct care workers a main priority. I want to thank Representative Fleming, Chairwoman Moser, Chair Meredith, and other co-sponsors of House Bill 200. I also want to thank the CEO Council for including us in this conversation, Josh and Dennis Fleming, and connecting us with Representative Fleming. I really do want to thank Representative Fleming for including not only nurses, but also state registered nurse aides in this program. I think Representative Moser would tell you, I call her all the time about our nurse aide shortage in long-term care. Our nurse aides are truly the backbone of long-term care. Creating more registered nurse aides is a start to building a nursing pipeline in the Commonwealth of Kentucky. On behalf of the Kentucky Association of Healthcare Facilities and the Kentucky Center for Assisted Living, we urge all legislators to support House Bill 200. Thank you.
Well, thank you all very much. We appreciate y'all coming here. We'd be more than happy to entertain some questions that y'all might have. But I just want to underline in bold and italicize, or however you want to phrase it. We're basically kickstarting getting this jetpack on the pipeline of fulfilling the workforce when it comes to healthcare. And as I said, you know, without healthcare professionals out there, service really suffers and people suffer. And so with that, thank you all very much. Be more than happy to entertain any questions you all might have.
Would funding, public funding for this have to wait until the next session, or is that something that can happen?
Yes, and I appreciate the question. Basically, we're not going to really open up the budget this year. So this is basically set up the framework in order for this to happen. It's going to take some time to go through it, to write some regulations that will support this. In addition to that, I know CPE and others will basically go out there and reach out to, you know, to the public in terms of looking to help put in some money in this. You know, money will be coming in here from all sectors. In fact, I got a call just a couple of days ago from an individual that basically said that, well, Representative Fleming, can I put this in my will to put money into this fund? I said, well, yeah, you sure can. So this is a very broad spectrum in terms of that. But yes, this sets up the framework for us to start operating sooner. And like I said, this is an emergency clause to get the ball rolling because we know how critical the situation is.
The bill says it prioritizes scholarships based on demand in a field, historically underserved areas, racial, ethnic, smaller employers. You determine, is there like a set metric for how that's determined, or is that subjective?
Yeah, CPE will go through and take we'll take a review of that. And Dr. Thompson, you want to address that?
Absolutely. I'm proud to say we have one of the best data systems, I argue the best data system in the country. We can break everything down in a disaggregated form. We're doing that now, as a matter of fact. There's going to be prioritizing, obviously based on need that needs to go in a pipeline, but we can't leave anyone out. I'm from Eastern Kentucky. If we don't concentrate in that neck of the woods where there is a high need, or inner city Louisville, whatever the case may be, this has to be an item that reaches out to all demographics, giving them an equitable opportunity to participate. Our employers have asked us to do that. We're more than happy to do that without the ask, but yes, we will have data. We have data already that would allow us to do exactly that.
Any other questions, comments?
Well, not necessarily a question, but to go off this point, if you could speak more to the need for probably more additional support in those rural areas where the population may not be, or healthcare resources may not be as concentrated, how that bill would affect that, those groups of people.
Well, I can address that because I went through and I chaired the EMS, and I know some representatives from KBMs are here. We work very diligently with them to look at the providing paramedics and EMTs out in the rural part, and that part of the state, nor eastern or western, there's a lack of workforce out there. And so this bill will help provide that avenue to get more people into the pipeline in order to serve that. So as Dr. Thompson, they'll go through and look at various areas that are underserved, as well as where the gap is in terms of what the need is on a particular discipline versus what's out there in the pipeline. So they'll be putting that information together and look at it from a broad spectrum.
And the nice thing about this, I'll just throw in that we are now not only looking at the immediate need, we are projecting needs, and we will even build some policy in a prescriptive way that allows us to actually put people in the pipeline before the need is accumulated. So this allows us to do both the immediate and the future process.
Anything else? Well, I tell you what, this is an unprecedented move. Like I said, I don't think there's anything out there in the state or in the country that has something like this. There's been public and private partnerships in the past, but to go after one particular profession and industry, it's unprecedented. And I think we're really making a strong move and moving the needle like we have been doing for the past couple of years in order to help address the workforce. So thank you all very much. Appreciate y'all coming.